and welcome to this week's episode where we are going to talk about your pet dander allergy. I am Dr. Salima, mommy to 4, 1, 2, 3, 4, and this channel is about all things related to allergy and a little bit of entertainment. So why did I pick this week to talk about your pet allergy? Mainly your cat or dog allergy? Well, we had a pandemic. We're still in the middle of a pandemic, and a lot of people actually got pets during the pandemic. And what happened? Well, I'm seeing a lot of folks now having some allergies to their pets. So let's start with what are allergies to pets. So when you're allergic to your pet, you can be allergic to the dander, to the saliva, to the urine. And so when you are allergic or your body becomes allergic, you're going to have symptoms like runny nose, nasal congestion, itching. We call this the allergic salute. I know, it's kind of funny doing that. Itchy, watery eyes. And some people can even have allergic asthma where they're coughing or wheezing or having chest tightness and shortness of breath. So what are some basic things that we can do? One is, I recommend getting tested, being seen by your allergist, and actually confirming that you're allergic to these things, okay? And then there are things that you can do in your home to decrease your exposure, okay? So first things first, we always say, well, if you can, get rid of your pets, but nobody's gonna get rid of their pets. I get that. Your pets are your family, okay? So the next best thing to do is actually have no pets, we say, in the house. Maybe they can be more on the outside, but I get that. Most people want their pets with them, right? So the next best thing is no pets in the bedroom, right? So you are hopefully sleeping 8 hours. Your bedroom should be your safe haven, right? Make it as clean as possible. And remember, if you're allergic to even just your pet, when your pet goes outside on their fur, there can be other things like dust mites and pollens and mold spores. So they're going to track all of that in, right? So keep them out of your bedroom. Number 2, you can get something called a HEPA purifier. So HEPA purifier. Now, one tip is there's so many great brands out there. I don't care which one you pick, but make sure it's a HEPA filter in there and that the square footage, right? So pay attention to the square footage, right? So once upon a time, I had a patient who had a really, really, really big one. It was great. It was awesome. And then they were like, oh, but I saw this really small one on sale and I substituted and I swapped out because I wanted something cute sitting in the corner. But guess what? I'm like, that small little one is covering like the corner of your room and not your entire home. Okay. So that's a tip when you're buying your air purifier. Okay. Bathing your pet at least every 2 weeks is going to be important, okay? And, from then on, there's medication options, all right? So what are the medications that can help you? Well, so if you're having a lot of nasal congestion, we call it a nasal steroid spray. And there's a lot on the market. All the nasal sprays are not created equal, okay? So things that I'm talking about will say glucocorticosteroid spray behind it. It decreases inflammation. So this is like your Flonase, your Rhinocort, your Nasonex. So I don't really care which one. You can get the generics of it. It's perfectly fine. They all work the same. But that's going to decrease the inflammation in your nose, okay? And remember, your nose and your eyes and your ears are all kind of connected. So we want to target the nose. The next thing is to add on an antihistamine. So things like Zyrtec, Claritin, Allegra, Xyzal. There's so many out there. I don't really care. Benadryl is out. Probably people have heard of the most. I don't like it as much because of the sedation that comes with it. And it's not 24 hours. So you need to dose it multiple times a day, okay? So second generation antihistamines, 24-hour effect, do wonders. After that, there are other options as well, like nasal antihistamines. So just like you take a Zyrtec, there is an antihistamine for the nose. Astelin is what it's called. And then there's other medications by prescription that you can get from your doctor, like Montelukast, also known as Singulair. And then finally, there's allergy shots, and people forget about allergy shots. But I know it's going to sound crazy, but I can actually give you injections to the stuff that you're allergic to. And this is amazing because it's what we call disease modifying, where I'm changing your immune system from behaving allergically to your dog to not having any allergies at all. Now, the biggest downfall to allergies is it's a big time commitment. And we're talking about 3 to 5 years of coming in, for your shots, okay? So I have a ton of patients who are getting shots to the stuff that they're allergic to. Now, if you don't personally have a pet, but you have allergies when you go see a friend, then I would say, pop in an antihistamine. You're going to grandma's house, a friend's house, auntie's house. Take that Zyrtec, an hour or two before you go, and while you're there, take it. But I get it. People will I have people, my husband has a cat allergy, and so he knows that there's a cat in a room, even if the cat is not in the room. A friend will be like, oh, the cat is like in the other room, but he will start sneezing. His nose will become runny. His eyes will become itchy because it's that instantaneous. And the cat dander is also very, very sticky. For those of you who don't know, cat pelt can actually stick on your walls for up to 16 weeks. So a lot of folks who tell me, oh, I gave the cat to grandma for the weekend and the allergies didn't get any better. And I tell them I didn't expect them to get any better because the cat pelt can stick around. I have some friends who will walk into a home where, the prior homeowner was a cat owner and they are sneezing and coughing and itching. And they're like, the prior owner must have had a cat, and sure enough, they did. So that is it for this episode this week. Now comes to the little fun part of the show. I got my 2 little girls with me, and we're gonna have a little chat with them. So remember, I have 4 kids, RSG baby 1, 2, 3, and 4. Today I have the younger 3 and 4 with me because they want a dog. Here we have RSG baby 3 and 4 right here. Okay. First of all, why don't we start with Anaya Bear? Anaya Bear, how old are you?
I'm 6.
Okay, and Misha Bear, how old are you?
5.
5. And I heard somewhere that you guys want a dog.
Yes.
Yes.
Yeah.
Okay. Do you know that's a lot of work?
Yes.
Like a lot of work.
Yes.
You have to feed the dog. You have to take the dog for a walk. You have to even pick up the dog poop. Are you going to do that?
No.
No? How can we get a dog if you're not going to do that?
I know. I'm going to get a trained dog.
Oh, you're going to get a trained dog.
Yeah.
Okay. So I heard you guys want to get a dog.
Yeah.
But we can't get one because Daddy has allergies to dog.
Yeah. But how come Daddy gets a dog?
Oh, when Daddy was younger, he had a dog.
Yeah.
That's right. Oh, yeah, but he has allergies to them now.
But Mommy, you're an allergy doctor.
Oh, yes, I am. So how about this? If your daddy is willing to get allergy shots, maybe we can get a dog then, okay?
Yeah.
Well, that is it for this week's episode. I'm only kidding, because unless they're ready to pick up dog poop, we are not getting a dog, because like I said, there's 4 kids already.
I know who could pick it up for him.
No. It's you or it's nobody. But join us again next week. Well, that's it for this week. If you like what you see, remember to
subscribe
and give it a
big thumbs up.
bye.